Gauteng has recorded a minimal decline in emergency calls on New Year's Eve compared to a year ago. 1,914 calls were received, with most being medical emergencies like epileptic episodes and asthma attacks. The most prevalent injuries were stabbings and gunshot wounds. For more on these numbers, we're joined by Gauteng Emergency Medical Services Director Reuben Ruiters. Reuben, appreciate your time. Can you give us more detail on the joint operations conducted by Gauteng EMS and the police that may have contributed to the decrease in these emergency calls on New Year's Eve?
Well, thank you very much for the opportunity to engage with you and the viewers. So what happened is we normally during the festive period, we will sit down with our law enforcement agencies, the police, the traffic department, where we basically study the previous data and draw up plans to ensure that the crime is curbed, and also as from our side, we ensure that we are also ready to render services, our health facilities, emergency services, we are ready to ensure that we render optimal services. So generally, you will find that all these plans being coordinated by law enforcement, combating crime. We as EMS services, by default, we then have less, incidents to respond to because they are more visible and they are on the ground and so on. But obviously, coming from the house calls, we see a spike in those medical cases that we've been seeing during this festive period. Followed by the gunshots, a lot of gunshot incidents. All the violent crimes happening in our province. We saw a serious spike on them, and we also noted that generally our MVAs, which is motor vehicle accidents, we break them into different categories. Pedestrian, motorbikes, trucks, and vehicles. We also saw a spike of our pedestrian accidents. A lot of people being hit by motor vehicles and bikes. We also saw, an increase generally of medical cases. People, having medical emergencies that we had to transport to various of our health centers. That's what we were dealing with during this festive season.
Now, you also received 42 suicide-related calls, which included poisoning, hanging, and I think overdosing, from what we understand. Would you care to speak to us on those numbers, please?
Yeah. So generally, it's a trend that we're picking up, that especially during this period, whether it's influenced by relationships or it's because of stress levels, we don't really know. We haven't done research on it, but we also see that cases coming through where people will receive calls being made on behalf of the patients by either their family members or their partners. And when you arrive there, you'll find people attempting to overdose themselves with the tablets, or some taking drugs, various ways of overdose. We haven't seen recently incidents where people want to jump off buildings currently during this New Year's Eve or the Christmas period. It is mainly poisoning being the main one, and some we have threats that they want to take their lives using firearms and so on.
Now, when you look at the discrepancy in those numbers from last year to or the year before to last year's New Year's Eve, the difference really is about 15, I think 1,929 versus 1,914. So only a marginal shift in those numbers. I'd imagine that your target would be to make a greater impact. Whilst 15 calls is a number, you'd want a lot fewer calls.
Yes, obviously from our side, we don't want to respond to such emergencies because we don't want them to occur. So our health facilities, our the various disciplines of health, they also try their utmost best to counsel people that are going through difficulties. You'll recall that during COVID, a lot of people lost their jobs, and obviously that brings by default stress levels and tension within a household. So we find it difficult to say what is the cause and how to deal with it. But as our services, we are also teamed up with our counterparts from various health facilities that are also available to give advice over the phone. Even now for our courses as well, to say how to engage with these people that are intending to commit suicide during this period. But it's something that we find that there are various reasons that might contribute to this, and we believe that due to the high unemployment rate, And, as parents or as life partners, we're expected to provide, and sometimes it can also contribute to that. But we something that we're monitoring, and obviously as a department with other departments, we putting data together so that we can plan further as to how we can further combat and educate our communities out there how to deal with this when they find themselves in these difficult situations.
Now, one of the key factors to the ability of, or how we judge the operational ability of EMS is how quickly you're able to react to these calls. Speak to us about what your reaction times are and if these are spot on where you would like them to be.
Well, when you look in terms of our reaction times, we like them to be that within half an hour we should be at any emergency in terms of reaction time. But due to the increasing population in Gauteng, our road conditions, the crime levels, the hotspots, the paramedic attacks, these are all factors that contribute to us not being able to respond on time so that we can reach our communities as per the required standards. But in terms of us, when we receive such calls, we then ensure that we dispatch the closest vehicles, because all our vehicles are fitted with tracking devices, which we are monitoring from a central location. And what we do is we'll dispatch the nearest available resource to such emergencies. And during this period of the year, you'll find that our managers that are normally in office environment, they are also now becoming operational, so that we have all hands on deck in terms of responding to our communities. We monitor our leave status to ensure that our crews we have maximum strength that will be responding to the emergencies that will be reported to us. So we try to ensure that we do more with less that we have currently in the province, and also factoring in our law enforcement to also enable us to can arrive quickly on scene, because when we have these incidents in areas that are classified as hotspots, we have to wait for our law enforcement to safely accompany us to arrive on the scene. And sometimes we have to wait for them, and that also contributes our reaction time. But generally, we strive our best to increase the service and to increase our footprint so that we can reach such cases when they've been reported to us speedily.
Now, Reuben, something that I've always wanted to ask is there many a time where I've seen an ambulance or emergency services rushing to the scene of an accident, right? And you pass by the accident, you see 3 or 4 ambulances or 4 or 5 vehicles, and the accident is either a very, very small ding that doesn't need 4 or 5 ambulances, and the second thing is sometimes it's a small incident where the one ambulance that is there is able to attend to those that are injured. How does this happen that you have multiple ambulances or multiple reaction to the same scene that may not necessarily require that measure of response?
Well, as you recall, in our country we have 2 types of ambulance services. We have government-regulated ambulance, and we also have various private sector ambulances. So as government sector, we are linked to our national emergency number being the 112 number. And when communities make use of their cell phones, calling 112, dialing 112, those calls are being routed to us as a government sector. And hence we will respond based on information given from the scene. And we find that normally it's more than one person that will call for the same accident and giving different descriptions. But in terms of private sector, they also have their own control centers that one way or the other they receive these calls via the call centers, and that ends up where multiple services respond to a scene. And when we arrive there, obviously the patient is priority. We'll assist each other working as a team to stabilize the patient because we are all there, and then one service will then stabilize the patient and transport to the health facility that will be the appropriate and closest from the incident. So we are not yet that where we have one system regulating all ambulances within our country. We are hoping, as part of the NHI, that this will be some of the changes where we have one major command center where state and private sector ambulances can be dispatched, because by doing so, it means we'll be more efficient, because currently we are not, as you've observed correctly, that we have multiple resources. So when we have one major command center, it means that only the required resources will be dispatched to that particular incident scene. So we are looking forward for all the changes that will be coming in with the NHI, and but we also ensure that when the scene is not that busy, we assist where we can, and then we release our crews to attend a different emergency where that would have been registered during that period.
Reuben Ruiters is the Gauteng Emergency Medical Services Director. Thank you for speaking to us on News at Prime.